There are 10% of any population at any one time suffering with chronic pain. In the States, that figure is in the 30 million range, and in Canada, there is a range of around 3 to 4 million at any one time that suffer with a chronic pain disorder.
You didn't buy it, and it doesn't belong to you. You can't have it. It's not yours. Do you understand me?
Beautiful lady. How are you doing this morning?
How do you know me?
You're in such a rush.
I don't even know who you are. I have to go.
I'm harmless.
Okay, miss? Can I help?
I'm fine, thank you. I'm fine. But thank you.
You seem to be in a lot of pain. You sure you're okay?
I'm fine. Thank you, thank you.
Is that your car?
Yeah.
I'll take you there.
You sure?
Yeah, come on.
Well, thank you for helping me.
You gonna be okay?
I'm going to be fine.
Okay.
Thanks for all your help.
No problem. Have a good day.
You too.
Good afternoon, Marcia. Welcome.
Hi, Flavia.
Nice to see you back.
Good to see you.
Make yourself comfortable. Tell me a little bit, how are you feeling today?
I mean, the first time when I had the accident, it was almost like I was hallucinating a little bit, you know? I was just out of sorts. I couldn't even remember where I parked my car. But this time, I keep seeing different people.
When you say you see different people, give me a little bit of explanation.
Well, it's just the strangest thing. I was driving here earlier, and I never, you know, like I wouldn't stop if I saw somebody on the side of the road, but something pulled me to pull my car over and stop, and it was this beautiful, young, blonde woman. Spoke with a sexy Russian accent. And you know what? I just told her, jump in. Let me help you. But she seemed so familiar to me, but the weirdest part was that the whole time I just felt an excruciating pain in my neck, my back. I mean, I just wanted to pull over the car and rest.
That's very nice of you, thank you. My car just broke down just at the other intersection, and I came down the road just to see if somebody would stop. I'm trying to get some help. Thank you. I really, really appreciate this.
You know, usually you don't pick up people standing on the side of the road, or
No.
even, I can't tell you the last time I picked up a hitchhiker, but there's something so familiar about you. It was almost like I knew you. I had to stop the car.
Thank you. I feel like I know you from somewhere.
But you look familiar, almost like a friend of mine.
Maybe in a past life.
Yeah, you think so?
Maybe we're just kind of like sisters under the skin.
That's funny you mentioned sisters under the skin.
You okay?
Yeah, getting a little stiffness in the neck. You know, I don't know why. You know, just all of a sudden I'm just getting these pains. I don't know what it is.
I mean, I know we just met, but if you would like, I can drive if that'll help you.
Oh, it's okay. I go. Yeah, sometimes the pain only really comes around if I drive, you know, too long, and I've been so busy all day. I just don't know. But ever since I picked you up, ever since I pulled over and you got in the car, I just keep feeling it more and more. I don't know what it is.
I hope I didn't bring in any bad energy.
I doubt it. Remember, we're sisters under the skin.
Yeah, we are. It must be so hard living in pain all the time.
It is. It's an absolute nightmare. It's enough to really drive you mentally insane, because it just doesn't affect you physically. It's emotional. It's physical. It's spiritual. I think it affects every aspect of your life. So this is good, you sure?
Yeah, just right here. Thank you.
Okay. It was my pleasure meeting you.
Thank you so much. You're so
Oh.
cute. You sure you're okay?
Yeah, I'm
Thank
okay.
you.
I'll be fine.
It was a pleasure meeting you. Thank you so much.
No problem.
Have a great day.
You too, hon.
Thank you. Drive safe.
Yeah, right.
Did you notice that the pain changed after she came into the car?
Yeah, almost instantly.
Right. And where did you feel the pain? What part of your body? Was it in your back, in your stomach, in your chest, in your neck? Where did you feel this pain?
It was my upper neck and going into my shoulders.
Now, the last time you were here, we didn't discuss about pain. I'd like to discuss about the 3 different types of pain, so you have a better understanding as we go through this. This is what we call physical pain. The physical pain means there's a physical injury and someone gets hurt. And when someone gets hurt, if they rest or they take a medication or take a Tylenol, the pain goes away. And physical pain comes and goes. Now, some people suffer what we call emotional pain. And the emotional pain means they've been through a trauma, through an abuse, physical or emotional abuse. And what's happening, there's unresolved issues that are stored in the physical body. And because they're unresolved, there's sometimes that the body trying to communicate through the pain, say, deal with these issues. Now, physical pain comes and goes, and physical pain can be released with medication, but emotional pain is there all the time. That means if there's stress or there's an anxiety or something is happening, then the pain level increases. As you become calmer, then the pain decreases. And in some cases, people suffer from both physical and emotional pain. What does it mean? There's a physical injury, but then there's an emotional component to it. It could be fear, it could be anger, it could be frustration, it could be guilt, whatever emotions. And now, what's happening, these people that suffer from both physical and emotional pain, they are in pain consistently. It may be small, it may be large pain, but it's always consistent there. And the only way we can work things out is by letting go of the emotional pain. Now, let's talk a little bit about this emotional pain. Let's talk about this. You said you had pain in your neck when this young lady walked into the car and you felt this pain in your neck. Describe a little bit about this pain. If you could create an image, what would it look like?
Dark, black.
Black. And would it be big, small?
It was big.
Would it be heavy? Would it be light?
It weighed a ton.
Heavy.
Heavy.
Was it smooth? Was it jagged?
Rough. Jagged.
Was it round? Was it flat?
It was round.
Now I would like for you to take this circle and take it out. And just imagine you put the circle outside this room.
Okay.
Now, if you look at the circle, what emotions are connected to this pain?
I don't remember.
Great. Now, if you look at this, see, because sometimes people come with the presenting problem, but each presenting problem is a root of a problem. It's just an example of a greater problem, a greater problem, a greater problem. And we need to find what is the greater problem, which when disconnected will allow this pain, that emotional pain, to disappear. So it will be much more easier for you to deal with the physical part of the pain. So if you go back in time now, and let's take fear, because fear is a very strong emotion. Okay? If you go back in time, when would have been the first time that you ever experienced fear?
As a child.
And how old were you?
I think I was very young.
5, 6, 7, 8. Allow your unconscious to reveal.
I must have been about maybe 3, 4.
Excellent. Now, you see this window here? Mm-hmm. Now I want you to imagine that you see the little girl, on the other side of this window. Okay? So that I want you to stay protected on this side, and you can see the little girl on the other side of it. So you can feel protected. Just let me know when you can find and see this little girl.
Okay.
And notice that you're on this side, so you're safe on this side. You'll be able to see what happened, but again, this window is protecting you, not to feel the pain that the little girl felt. Now, as you look at the little younger you, at the moment as this was happening, what emotion did she experience? What was she experiencing?
She's afraid.
Fear?
She's fear.
What?
She's ashamed. She doesn't think she's any good. She feels dirty.
Well, hello there, little girl.
Hi.
What are you doing here?
Just walking.
Yeah, what's your name?
Marsha.
Marsha. Okay, Marsha. I want you to walk with me. I'm going to show you something.
Now, I look at the little girl. What's happening with the little girl that allowed to feel this fear? What was going on at that time?
She was being hurt.
How she was being hurt? Who was hurting her? Physically hurt? Emotionally hurt? Which hurt?
I think she was being abused.
Any other emotion?
She feels guilty.
Any other emotion? Anything else?
Sad. Scared. Did I say scared?
Yes. Now, what's the difference between being scared and fear?
She's in fear of him, but she's afraid, but she's scared someone's gonna find out. So she's living basically in fear.
Right. Find out about what?
I think what he did to her. He did some horrible things to her.
Usually, when this happens, some things happen to the individual. Look at the little girl now. There's there. Did she lose anything when this was happening? Did she feel that she lost a part of herself?
Yeah.
And this part of you, what would you call it? Is it the innocence? Or what would you call it, this part of you?
I feel it was the innocence.
Yes. And now, if you look back now, where's this innocence? Where is it? If it could be anywhere, where would it be?
I left it in Jamaica.
Okay. In your imagination now, I want you to visualize Jamaica, and I want you to visualize where this part of you is.
Okay.
Okay. And I want you to bring that part of you back now. Bring
that part back to me?
Yes. because it belongs to you.
Okay.
How does it feel now?
Great.
That's right. Now I want you to look at this person in front of you. Tell me a little bit about this man. Who is he?
I don't know. I mean, he's handsome. He's tall. He's got dark hair. He's got a killer smile.
Look very closely. Is he really tall, dark, and handsome?
No.
What's he look like? The truth of it.
He's not pretty at all.
That's right.
He's scary, and he makes me feel not nice.
That's right. Now, what is inside of you, this man? Where is he inside of you? If he could be anywhere, where is he?
He's in my neck.
What does it look like?
Terrible. It's dark, it's ugly, it's...
Okay, why don't you take it out? Take it, pull it, and put it right there in front of you. Because you don't want to give him any more power. Do you understand? You need to face it. You need to understand it, and then we can finally release it. So notice where it is. Notice what it looks like. Does it have a figure? Does it look like a figure? Does it look like a square? Does it look round? Does it look like a person? What's it look like?
Flavio, who are these guys?
Well, remember during our sessions, you kept on seeing different images. One was a young man, well-dressed. One was different. The young man represents the version in your own psyche of the person that attacked you. Because it was a relative, it was old, okay, and it was somebody close to you. You could not see him as being a relative because it would have been outrageous. So in your mind, to protect you and to protect the people around you, you created to be someone else, and you created a younger man.
Because every time I see him, I'm terrified.
That's right, because that represents evil.
Okay.
At the other hand, this represents the angelic part, represent of all of the people around you that are trying to help you. The counselors, the doctors, the physiotherapists, the massage therapists. And these are all the people that have been trying to help you in order for you to get better, for you to let go of the pain. And once more, as you can see, one represents evil, and the other one is angelic. It's all of the things that are in your life now.
Every time I see him, he's always helping me.
That's right. It's because there's always going to be people around you that are willing to help you,
Right.
for you to get better. Now that you put this outside of you, how does it feel?
Feels better. Feels not as painful as I was when I walked through the door a couple minutes ago.
That's right. Now, if you could look at this pain, you could look at this identity. Who is it?
It's... If I could look at it, well...
Well, just take a look at it. You see it on this side. Just look at it on the other side. This window is protecting you to see what's on the other side. Although it may be something bad, you still can see it, but it won't affect you on this side.
Well, she's blonde. She's sexy. She's always around. Seems that she's always around. Like, I sometimes see her in the morning when I wake up. I just see her everywhere. But on the outside, she seems so nice.
Well, that sometimes happens because we don't want to feel the pain. We don't want to feel bad, so sometimes we create images of good things in our mind so that if we create something good, it makes us feel better to overcome what the problem is.
So are you saying that the hot Russian blonde is the pain in my neck?
That's not what I'm saying.
Oh, she's the pain in my neck.
Did you notice what happened when she came into the car?
Yeah, I started being in more pain. It was like the intensity of the pain got higher and higher.
Correct.
Went from like a mild to excruciating. Oh, okay.
That's right.
Okay. I didn't even realize that.
Right, so now you know what the pain is. Also look at what you put outside that window. And if you could create an image of that, what it would look like?
It would look like the blonde Russian
That's exactly right.
who jumped into the car.
That's exactly right.
Right.
Yeah.
It would look like. That's why my neck was hurting me more from the time she got in the car till I let her out. Okay.
You understand that now?
I get it. She's my pain. In my neck?
She's the pain.
The pain.
The pain.
Not my pain.
Right. The pain.
She's the pain.
Right. Now that you understand the relationship between this beautiful woman and pain, are you ready to let go of this pain?
I want to get rid of this pain in my neck. Yes.
My question is, are you ready to let it go?
Yeah, I can let it go.
When can you let it go?
Right now.
So why don't you just release it?
Okay.
Release the pain and just see it walk away. Just let it go. Just melt it. And see it totally disappear from your body. Just let it go.
Okay, yes.
Now as you look at it, is it time to let the decision go now about not to speak out?
Yeah.
Go ahead, let it go.
Okay.
And notice that I want you to go back from the moment all the way down to the present now. Of all the time you could have said, you could have had a voice, you could have talked, and disconnect all the time that you kept quiet. And see what you could have done differently. And see how you've been heard, how things maybe you would let the pain go a long time ago. Because we want to teach everybody that not to hold down to the fear.
Because the quicker I do it, the better you're behind me and you become my past, right? The quicker I get you away from my family, the better. I'm gonna put you in jail one day for what you did to my mother, my brother, and me. No, you're a liar. You're a liar and a child molester. Don't let my mouth open in until today about your child molestation. You understand me?
It's time to let the connection go between you and your step-grandfather. And now you're ready to let him go. And just imagine how you cut this cord between you and him. And as you cut this cord, you can feel it just disappear. And as it disappears, you can feel the lightness. You can feel the release within you. You can feel the arena you coming out. You can feel finally that you can be connected within yourself as you let all these things go. And notice how wonderful it feels. How's your neck?
Like, better. Like, I mean, you know, there's still soreness, but not to the degree that I came here. I mean, I came here distressed. Now I'm mild. That's really good, Flavia.
Now you have to, once we finish, then you have to deal with the physical part of the pain. It could be injection, it could be physiotherapy, it could be acupuncture, it could be massage therapy, whatever modalities you're going to use to work on the physical part.
I do have an amazing team. You know, I've been getting the nerve box from Dr. Jacobs, and I've also been getting the Botox injections, and I have an amazing chiropractor. So I am getting some help. And finally, after 12 years of living in chronic pain, I have an MRI coming up to see if there's more physical damage. But I never understood the emotional aspect of pain. I just always knew it was in my neck, it was in my shoulder, it's in my back. When they told me, you know, when doctors say it's in your head, I had no idea
What it meant.
what that meant. And that's the emotional pain of chronic pain.
Chronic pain is a major problem in the world today. Throughout history, the person who complained of a chronic pain was thought to have some other issues related to psychological issues that were causing their pain. Today we know that that is partially true, but the knowledge has expanded to such a degree that we now know that there is a multitude of factors that contribute to this incredibly large, overwhelming problem that is present in the world today. The problem with chronic pain with patients is that they first have to convince themselves that they have the problem. This might sound very strange because they have the pain. The problem is that for many times that patients do get into pain in the first place, they are advised usually that they're going to get better. This is not a great bit of advice at the beginning, because some of the patients will not get better. What happens is they get this false security. I mean, think of it logically. They are a person who's never been involved in anything like this before, and all of a sudden they wake up with a pain. And then they can't understand this. Can you imagine, you get a sore tooth and the sore tooth goes away, you go to the dentist and life goes on. Imagine what it's like if you go to the dentist and the pain didn't go away. People do not also realize that people who are in chronic pain have high rates of suicide, and the death rate is extremely high amongst this group of patients. I do believe that in the future, as more knowledge becomes available, it will be a disease that will be recognized, and it will be a disease that will be treated appropriately, and that the stigma of the pain patient will be lifted. It's an important issue, this stigmatization of chronic pain. And this goes back to biblical times, that patients or people who suffer with chronic pain were thought to have been invaded by the devil. In society, they were shunned upon. And then as the years went by, people discussed the issue of pull yourself together, you are a weak person. So society has always looked at the chronic pain patient with a certain amount of skepticism. It is unethical and it is immoral that patients who do suffer with these forms of injury are shunned by society. Another major issue in relationship to chronic pain, which we're going to see a lot more of, and which has been on the agenda of the United States, is the returning veterans from the wars that our country is engaged in at this time. This is a major issue, and unless the public understands chronic pain and doesn't get a twitchy feeling in their stomach when they hear chronic pain and think, poo-poo, it's only chronic pain, these veterans will be disenfranchised and will have a very serious, horrifying future. The reason why I say this is that the pain of trauma is devastating. Many of these troops will return and they will get their obvious injuries taken care of, and then they will be advised that things are fine. Unfortunately, it's not going to be that way. There is a pain problem called neuropathic pain, and you will get to hear about this more and more as time goes on. An example of neuropathic pain which we see in medicine is the post-herpetic neuralgia, which is what people suffer with when they have shingles and they end up getting pain in their chest wall, which continues way after the treatment has finished. The other disease which people are aware of is post-diabetic neuropathy, where in a diabetic the pain of the nerves becomes extremely devastating and again requires very aggressive treatment. In fact, many of the pains that we now see, even back pain, is now being considered as a form of neuropathic pain. So by not treating these patients with neuropathic pain, you can imagine the life that we give them and the life they're stuck with until the day they die. Let me just give you an example of what neuropathic pain is like. Neuropathic pain is a poker, iron hot, stretched across your back down into your leg. Or something else you may even be more aware of, because I don't think too many people get pokers struck across their back. How about sunburn? Many of you will have suffered with sunburn, and you know, it lasts for a day or two, it hurts a little and it goes. Can you imagine what it would be like to have that on an ongoing basis, on which people are telling you there's nothing wrong? This is the way you have to start thinking of people who suffer with chronic pain. You have to realize that these are real issues. Or even a burn. Did you ever burn yourself? Just a second, you pull your hand away and it lasts and lasts. Try living with that for 30 years. So this is what we're dealing with. And really it is the only way in which one can understand it, is to start realizing that this is the pain that people are suffering. So these returning veterans will have to be treated appropriately, will have to be treated by experts, will have to be treated by a team. Where is that team today in Canada? Nowhere. Those teams are not available. We have a responsibility to these vets, and we have a responsibility to all the patients who suffer with these injuries. And we have to get going on it sooner rather than later. Again, in the United States, they have been very progressive with this. It is now rules and regulations that state that chronic pain has to be treated. That chronic pain not treated is considered unethical and has been a basis for lawsuits already. So it's time in Canada for us to start the ball rolling. Canada has always been in the forefront of many, many innovations, and it will continue to be in the field of chronic pain. I'm very, very confident. We have many, many people in this country who are dedicated to this area, who are dedicated their lives to treating these patients and to researching. And we will be one of the forefront countries in treating these patients with our record of ethical behavior. We have to plan for the future for chronic pain. That might sound weird today, but you will not be happy in 20 years' time if, when you're in need of pain relief from degenerative arthritis, from other diseases, even active rheumatoid arthritis can sometimes peter out, but the pain remains. So pain will be a major issue over the next 25 years. And it might actually be an issue for you and for me. And what are you going to do when you can't move and you can't walk because no one knows what to do with you? So what's really needed in society is to let's move on from the question of whether it exists and are these people crazy and is it all psychological. I think those times are over. I think now we have to move and plan for what is the appropriate method of approaching this major issue. There are a number of ways in which one can do this. One is knowledge on treatment, which is one whole discussion in and of itself. The other issue is education. And what does one have to do? One has to educate, first of all, the educators. That's the most important thing, because our future is in the hands of our children. Our future is in the hands of our future caregivers, our physiotherapists, our doctors, our chiropractors, our physiotherapists, our psychologists. Right now, you may not believe this, the amount of education given to pain relief in medical school is less than 2 days in all. Can you imagine? Veterinary medicine gets more on pain relief for animals than we do for humans. This is a disgrace. So now is the time. The money has to be put into the medical schools and to allow for them to have pain medicine as part of an overall curriculum. That's the first thing. The second thing is the universities have to realize the importance of having courses in this as part of their program in medical school. Chiropractors, physiotherapists, massage therapists, they all have to be educated, and there has to be courses available as part of the overall teaching. When that happens, then there will be progress in this area. Getting back to the patients who are traumatized, the stigmatization of these patients has been a black mark on society, and I think that the story has to be told on both sides, and especially from the side of the patient, as the insurance companies have had their side spoken about many times, and they seem to make it to the media, whereas the patient does not. Now I wonder why that would be, but you and I know that the financial support and the resources available to these large corporations far outweighs what is available for individual patients, and they don't have a chance. This is their chance. This is their chance to tell their story so that the other side can be told with honesty, with scientific fact, and I make that point. This is not about voodooism. This is not about junk science. The science is there. Why isn't society taking hold of it and accepting it? The reason is they're not prepared to listen, and there is very little for them to listen to. So now, hopefully, they will have at least a forum to discuss their issues and to get at the facts as they really are. I think the time has come to open up the knowledge base, to open up the understanding. And I think it's also time for the people who are involved in trying to treat chronic pain, who are not appropriately trained. It's time for society to take a closer look at these people. Now, why do I say that? Because in the end, these people only make things worse. They feed on the unfortunate situation of these patients, and they try to sell them things that have no basis. We're beyond the oil. We are beyond the ignorance that we were. And I think society has to keep up with the present status of our knowledge with these patients. Bringing it down to the level of the patient, as I mentioned, these patients are stigmatized by society, and also they lose their jobs and they lose their livelihood. Society has to look after these patients in order to establish a recognition that these patients are ill. Again, it is my hope that the society that educates itself will eventually be able to understand this growing epidemic of chronic pain. I think this documentary may be one of the early steps and one of the major contributions to Canada being in the forefront of changing how we manage chronic pain.